To mark the axillary artery on the surface of the body, first I will talk about the gross anatomy of axillary artery, its origin, termination, course, and its branches. So, at the end of this video, students should be able to know the gross anatomy of the axillary artery. Axillary artery is the chief artery of the upper limb, which is a continuation of the subclavian artery third part. Begins at the lateral border of first rib and ends at the lower border of the teres major muscle, from where it continues as the brachial artery. The course of the artery is, throughout the course, the axillary artery is accompanied by the axillary vein inferomedially. It's closely related to the brachial plexus cords and its branches. The axillary sheath, which is a derivative from the prevertebral layer of the deep cervical fascia, it encloses the proximal part of the axillary artery vein together with the brachial plexus. The significance of this is these neurovascular structures in the axilla are normally protected by the arm on the side of the body and also by the axillary fascia. But these structures are vulnerable to injury when the arm is abducted. When the arm is at the side of the body, the artery presents a bold convex curve directed upwards and laterally. When the arm is rotated laterally and abducted to 90 degrees, the artery assumes a straight course. When the arm is raised above the head, the artery presents a concavity that is directed upwards. The pectoralis minor muscle divides the axillary artery into three parts. The first part of axillary artery, it lies proximal to the pectoralis minor muscle. The second part of the axillary artery, it lies behind the pectoralis minor muscle, and the third part of the axillary artery, it lies distal to the pectoralis minor muscle. Talking about the relations of the first part of the axillary artery. Now the relations of the first part of the axillary artery, the anterior relation includes pectoralis major and its covering fascia, skin, cephalic vein. The posterior relations of the first part of the axillary artery is the long thoracic nerve and the medial cord of brachial plexus. Laterally, it's related to the lateral and posterior cord of brachial plexus, the medial relation being the axillary vein. Relations of the second part of axillary artery, which lies behind the pectoralis minor muscle. So obviously, the anterior relations of the second part of axillary artery is the pectoralis minor muscle. Over that lies the pectoralis major and the covering fascia and skin. Lateral relation is the lateral cord of brachial plexus. Medial to the second part of axillary artery is the medial cord of brachial plexus and the axillary vein. The third part relations anteriorly, the pectoralis major muscle and the medial root of median nerve. Medial relations will be ulnar nerve and axillary nerve. Posteriorly, it is subscapularis, the latissimus dorsi muscle and the teres major muscle. Lateral relations of the third part of axillary artery are the coracobrachialis muscle and biceps brachii. The branches given by the axillary artery, it supplies the thoracic wall and the shoulder region. The first part of axillary artery gives one branch. The second part of axillary artery gives two branches. And the third part of axillary artery gives three branches. The branches names are, from the first part, it is the superior thoracic artery. From the second part, it is the thoracoacromial artery and the lateral thoracic arteries. The third part of axillary artery gives three branches and the names are subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Talking about the clinical correlations of the axillary artery pulsation and compression. So the pulsation of axillary artery is felt in the lower part of the lateral wall of the axilla. The axillary artery can be effectively compressed against the lower part of the lateral wall of axilla to control the bleeding from the distal part of the upper limb.